Hello, everyone. Welcome to CURA. I'm Karthika Chalagunla, your co-founder and executive director of media and marketing.
Hi, I'm Christelle Elchar, your other co-founder and the executive director of operations and outreach.
CURA is a student-led initiative that aims to amplify the stories of healthcare heroes and serve them along the way. Today, we are joined by one of our healthcare heroes, Dr. Sarah Weihmiller.
Dr. Weihmiller, could you tell us a little bit about yourself, your career, and how long you've been in the medical field?
Sure. So I am a pediatric emergency medicine physician, and the amount of years is many. I have been an actual doctor since I graduated medical school was in 2003. After that, I did 3 years of pediatric residency, but then I did a chief resident year, so it was a completed in 4 years. Then I did fellowship in emergency medicine, specifically pediatric emergency medicine, for another 3 years. And then that landed me to 2000. Well, my dates are all messed up, but I've essentially been a doctor after my fellowship since for about 15 years now.
Mhm. Thank you. Our next question to you is, what initially drew you to medicine? Was there a specific moment or experience that made you choose this career path, or have you always been interested in it?
Well, I grew up in the hospital because my dad was a surgeon. So I followed him around, watched him give lectures, watched him work with students because he worked up at Columbia and was in a teaching hospital. And I just loved the teaching aspect of it. So that always drew me to it. And then as I was doing my studies, I always was science minded, kind of loved my biology, and everything kind of pointed in that direction. And then I decided to go to medical school, didn't know what I wanted to do. And in terms of what field of medicine, I just knew I loved that it combined science and research and teaching. And ultimately, after medical school, after doing a lot of rotations in pediatrics, landed in pediatrics. And my favorite pediatrics rotation was emergency medicine. So kind of grew up knowing that's what I wanted to do, but shifted a little bit in which direction along the way.
Mhm.
That's great.
Yeah, that's amazing to hear. Was there something specific about emergency medicine that kind of interested you?
Yes. So I really loved the idea. You'll see, for those of you who go to medical school and then see rotations, and there's very, very different feels for each field: pediatrics versus surgery versus internal medicine, radiology. And when I knew I loved pediatrics, a lot of times when you see the kids on the floor, they already have their diagnosis or they've been worked up. Someone's already been able to think about what's going on with them and do testing. I kind of liked in the emergency department, you got them fresh. You just had a symptom, you had to figure it out and really use your brain to think about all the possibilities. And then, of course, in the emergency department, there's a lot of procedures. So that was kind of a fun thing for me too, to know I could do procedures, lacerations and repairing broken bones. And then lastly, of course, there's the trauma, which is hard in its own way, but it does keep you on your toes and really keep you focused throughout your whole shift. So there's just never a dull moment.
Sounds wonderful. What qualities or characteristics do you commonly observe in yourself and other individuals in this career?
So again, I like to point out that for people wanting to go into medicine, each field has such different personalities and things that work for that field, all great in all different ways. I would say for me in pediatrics, it's a loving field. I mean, you'll talk to pediatricians, they love their patients, they love their colleagues, they're very giving in their time. They are very good listeners. They have a lot of patience. That's a big one for pediatrics. A lot of people who don't want to go into peds say they like the kids, but they have trouble having patience with the parents. And there's truth to that because parents are very stressed when they bring their kids in, regardless if it's emergency medicine or where they're bringing their kids. So I would say those are for pediatrics specifically to have a lot of patience and just want to give your patients a lot of time and a lot of love for your colleagues. And emergency medicine specifically, you have to be able to be calm in crazy situations. That's a big thing for that's what my mentor said. You're very calm when you are dealing with total chaos, and that was a big characteristic that helped me succeed in emergency medicine.
Yeah, that's wonderful to hear. I know you touched on this before, but what did the educational and training process look like for you?
I did medical school in New York at Columbia and stayed there for residency. And it was a big turning point. And this is kind of I teach this to a lot of medical students, and residents. So it was Columbia was amazing. So it's in New York City, great population, very busy, teaching hospital. It would have been the easy road would have been to stay at Columbia to do my fellowship, the extra 3 years in emergency medicine. But I had a mentor who told me, go somewhere else, learn new things, learn new people. It will really enhance your career and your background, your knowledge, because people do things differently in different ways. And it was hard. It was hard. I loved New York, but I went up to Boston, had an amazing fellowship up there. The team at Boston Children's is incredible. And ultimately, it was one of the best decisions I made for my career and the things I learned up there, and of course, developed a whole new slew of new mentors. And that kind of took me down a different road, never ended up back in New York, but ended up working in Delaware and then ultimately here in Charlotte. So,
Yeah, it's amazing to hear.
Um, what does a day, and I know you touched on this a little bit before, but what does a day in your life look like as a emergency physician? What do your daily responsibilities kind of look like?
so emergency medicine is a little different because it's kind of shift work, not unlike a lot of other specialties where you're on call and you're not always in the hospital when you're on. In emergency medicine, when you're on, you're on. So you're in the emergency department anywhere from your shifts are usually 8 to 10 hours. You're often there later because you never, if you're the only one on shift and a trauma comes in or a code comes in, a really sick kid, you're going to stay until, things are settled for the next person. So it's shift work, and you come in and you can come into an emergency room that's full of people in the rooms in the emergency department, or it can be slow and you kind of have a chance to catch up and get the information from the attending that's coming out. But the day in the emergency department, it's a lot of chaos. It's fun chaos. You'll have really sick kids, you'll have kids with just colds. You're going in as an attending, you have residents and students under you. So a lot of times they'll go see patients and you'll supervise. And emergency medicine and a lot of medicine allows you to do teaching on shift. So you'll go in with a student, teach them how to do laceration repair or how to take a history, or so a lot of your day, especially in academic hospitals, are teaching, which is a great part of the job. If you're in a community hospital, you're going to be doing less of that. It'll be just you seeing the patients. So it's a different feel. And you're doing that for 8 hours. I mean, there's never a dull moment. You're not really taking time to run to the cafeteria to get lunch because you just never know what's going to come in. But you're working with your team, your students, your residents, your nurses, your techs, your administrators. So kind of working as a collaborative unit to see all the patients that walk through the door.
Yeah, it's awesome to hear. Our next question to you is, have you experienced any memorable or even funny moments in your career path?
Many memorable ones. It's emergency medicine. You see a lot of hard things,
Mhm.
and I would have to say, unfortunately, a lot of the memorable ones are often harder cases and sad cases. Those just stick with you forever. Those are the most specific things that stick with me. But I would say, I mean, in pediatrics, you laugh a lot. The kids are hysterical. The things they say, the pictures they draw to say thank you. I mean, you just never know what's gonna come out. I wouldn't not one specific one stands in mind, but I would say that, I mean, a shift never goes by where you're not just, even in all the chaos, laughing and really just remembering that life is pretty awesome when you see these kids who haven't seen, a lot of the world, so they're just happy and having fun.
Thank you. Yeah, that sounds wonderful, having nice little moments every
Yes.
day. Um, what do you think are your least favorite and favorite aspects of your career?
The least favorite, I mean, emergency medicine specifically, I mean, medicine in general, it's a lot of hours. So even before you choose what you're going to do, medical school is hard. Residency is a lot of hours. You're going to work hard through all your rotations and can be up for 24 hours plus more straight. You miss out on things. You've got friends after college who are out and having fun, and you get to do plenty of that. But a lot of times you're more committed than people that, in terms of hours and in terms, compared to people who are doing other graduate programs. And it's very time consuming and exhausting. So that's really for everyone. I would say for emergency medicine specifically, the hours are hard. They're evenings, they're overnights, they're long, you're on fully, you're not sitting at a desk, you're on the whole time. So that's the most challenging, I would say, overall, is the hours and the cases that you see. Because you're seeing everything, even a lot of bad stuff. But it's rewarding too. I mean, you are, thankfully, especially in pediatric emergency medicine, you are truly getting kids better. You're saving kids in a lot of situations. And my favorite part about all of that is, even with the cases that are really hard, is the team you work with. The nurses are unbelievable. Everybody comes together, especially when there's a bad trauma or a sick kid, and being able to come together after a hard case and talk through and be there for each other. You really become a family in the emergency department, and that's kind of my favorite part about it, in addition to all the teaching.
Yeah, it's really nice to hear that you have a supportive community to get you through these moments.
Hmm.
And you kind of answered this in your last response, but if you could touch on it a little bit more, is it difficult to maintain a work-life balance with emergency medicine, and how have you dealt with that?
So this is where fields are so different. And yes, so specifically to emergency medicine, I have, in most ways, it's, again, the hours can be very hard. So an 8-hour shift really can become 24 hours between getting there and staying after the chart or to stabilize, and then, needing to sleep for, 10 hours after a shift or so. Um, and just the off hours. So the off hours are kind of a mixed blessing, because if you work evenings, you can go to your kids' plays during the day, or if you work over the weekend, you can be around for events that happen during the week. So you can kind of maneuver your schedule around your family schedule. Um, for example, when I had my second, I have 3 kids. When I had my second, I switched to all overnights. So I had a toddler and a newborn, and I was able to just work overnight. So I would go into work at 11 p.m., work all night, come home around 8 a.m. So I'd be able to be around them during the day. I'd be home for dinner time, home for bedtime. So there's a lot of flexibility in the shift schedule. So that's how I was able to do that, and make it work with kids.
Mhm. You got it.
Um, and then, one of our last few questions. If you could go back to the beginning of your medical journey, what do you think you would do differently, or would you choose to do everything the same, or kind of how would you lead it now?
Hmm. Yeah, that's a great question. I wouldn't choose the ultimate profession or field that I'm in. I wouldn't choose differently. I mean, I've thought about that a lot, and pediatric emergency medicine is my thing, and I'm happy. It's where I want to be. It's where I feel like I was meant to be. And teaching is definitely the way, you'll, as you go and make these choices, you'll see you can do community medicine or you can do teaching medicine. And I wouldn't change the teaching medicine for anything, because those are some of the most rewarding moments. I think I've had colleagues who have done a lot of international medicine, going to their world countries to volunteer, to work for semesters or months or weeks. And I really didn't do any of that during my training or my career. And it's not too late. I can still do it, but it is a whole different type of medicine. And I think it makes you a stronger physician. So that would probably be the only thing I would do differently, is really try and incorporate that into my career more to get that perspective on things.
Yeah, that's really awesome to hear. We can both tell how passionate you are about this career, and it's just amazing to see. And then our final question of the day is, what advice would you give to an aspiring emergency medicine physician?
I would say really, really think about who you are, what your strengths are, and what you want to do. There's a lot of, as you go through being pre-med and medical school, and then even by residency, is you have a lot of choices, and it's very easy for people to say you should do this, or feel like I should do this because it will make more money, or it's a better lifestyle, or it's whatever it may be. Just don't make choices based on what you think you should do, and really think about what works for you. Do you want to be home more? Do you want to, is money important? Is, being in an operating room important? Is just to really be true to yourself and not do what you should do, but what would make you happy.
Yes, that's amazing to hear. Thank you, Dr. Weihmiller, for talking to us today.
Right,
It
of
was
course.
truly inspiring to hear your story and everything about emergency medicine. I know that I've personally considered going into trauma surgery or anything related to that, and this
Hmm.
has given me a lot of insight into this career. So just thank you.
And I
Of
think for
course.
me, as well, I've thought a lot about pediatrics. I babysit, I interact with
Hmm.
children. I think they're just wonderful. And hearing your insights, especially how they can really brighten up a sad or hard shift, I think that
Hmm.
really just helps to, give insight to kind of maybe what I want to do. So thank you so, so, so
Oh,
much.
you're welcome.
Uh,
Anytime.
thank you. Yes.
And I think that is it for today.
Great. Well, thank you, girls, for doing this. This is a great project. So good luck.
Thank
Thank
you.
you.